Yes.
Yes.
Okay,
Yes,
great.
please.
So thank you all for the time today. I want to share a little bit about what we're doing with WHO around a notion of a global digital health wallet or regional health wallets. The idea I think everybody is familiar with is that as an individual, you want to be able to hold your health records or control access to your health records through your phone or device. And these could have multiple uses. It could be for travel, for mass gatherings such as the Hajj. It could be just moving across borders and wanting to seek care as you move across borders. Vaccine cards, the yellow cards are very important, things that you would want to have access to as you um, uh, try to cross those borders and ensure your records are up to date. Or you have a maternal and child health card with immunizations for your child that you want to keep with you. These are all sort of different types of things that you could imagine in a digital wallet. These are all clinical information. You could also consider things such as health insurance cards, or if you're a health worker yourself, a license or credential related to your education, your registration with a professional counsel. So these are all sort of information about ourselves and the health domain that we want to carry with ourselves. Um, and how do we do this in a systematic way that can work not just in one country, but within a region and globally? One of the key things that helps, particularly with the clinical information, is something called the International Patient Summary, which I believe you've heard about. But it's a summary of health information, not a complete picture, but key problems, allergies, medications, immunizations that would be needed in a unplanned care episode. And it's a natural place for things such as the Hodge Health Card, the Yellow Card, or maternal and child immunization card for that type of information. So we're looking at both trying to find standards and recommendations for the health content that's interoperable, as well as how those documents are exchanged or those cards on the wallet are exchanged. We have a few key objectives, and we want to make sure that we protect and promote the welfare of the individuals, communities, of the population as a whole. We want to ensure there's equal treatment for individuals and avoid any inequities, particularly things like access to smartphones, et cetera. What are the balances that we need to put in place between people that have low or no access to technology versus those that are, relatively wealthy and have access to smartphones? And how do we create and maintain trust in these wallets, in the content of them, both by health workers as well as users of the health system? So I think there's some of these key objectives that we need to consider as we put together these regional and global frameworks. The work that WHO is doing was driven or initiated during COVID, when there were a number of different types of COVID certificates for vaccination and testing that were in operation globally. We had, and many of you participated in the EU Digital COVID Certificate. ICAO, the International Civil Aviation Organization, had another standard. There, there's another standard coming out of India called DIVOC that was used in the region, and out of the US, something called Smart Health Cards. They all had different standards for interoperability. They all had different standards for verifying the content and the veracity of where these um, documents came from. And based on that, we saw a gap in a need to have a global space for this. And so WHO took up some of the work from the EU to try to build a global um, digital health certification network, and that's sort of where we are today. It's a public infrastructure that WHO is operating, and that we plan on using in the upcoming Rexel Connectathon. So just to remind you, for those who've seen this briefly, or just a quick overview for those of new, that the Global Digital Certification Network consists of sort of three steps. The first step, WHO will work with member states and other eligible participants to help set up structure for the use of public keys to verify signatures on documents that have been issued by a country A. So WHO will go through and ensure that country A is really country A and the keys that are being provided are authentic in step one. So we take on the organizational identification role in the trust network, for those of you that are familiar with that language. In step two, we now distribute those keys that we've collected from each country to the members of the trust network, and we actually make them publicly available. But those keys can be used to verify document signatures. They can be used to help ensure um, secure connections between countries. But in step three, WHO now steps out of the picture. Now that every country has these public keys, an individual can go from one country to the other, share their health documents, and then in the country that they arrive to, the document can be checked, its signature, to ensure the veracity. In step three, WHO has no any information that a health document was verified. It doesn't know who traveled from country A to country B. We don't know, we certainly don't see the information in the health documents. We're out of the picture. If you want to think of it, WHO is creating a very fancy phone book of public keys and distributing it to its members. It's not making the phone calls, it's not operating the phone lines. That's up to each individual member state to do that. That way, we can ensure the privacy of individuals per each country's jurisdictional requirements. Currently, we have around 80 some participants that are already onboarded in green or in the process of onboarding, and see, many of you are in that process, and so thank you. So this is a growing network, and we do expect it to continue to grow, especially over the next year. And we'll talk about one of the reasons for that in a minute. All of the specifications and how to join the Global Digital Certification Network are published at smart.who.in/trust. And it goes through the specifications on what types of public keys to use, how do you onboard onto the trust network, and some of the specifications that you can use for producing verifiable documents, and in particularly verifiable QR codes, building off the work from the EU DCC. So one of the main uses that and why we're talking today is for the Pan American Highway for Digital Health. So as individuals are moving through the region, they want to be able to take their health records and ensure that they are trusted. So as you all are joining the GDHCN, that provides that public keys to all member states and all uh, anybody that wishes to check, will be able to verify together the veracity of these health documents and improve the quality of care across borders as people are able to bring their health records with them. What we want to do with and what we have done with the GDHCN is really try to leverage existing standards, existing deployed infrastructure, and in particularly just to call out, there's the H cert, which is a specification for the QR codes to be signed. This is the same one that was used during the EU DCC. So we know that there were 78 or so countries that participated in that network, so we know that this is something that works and can be leveraged going forward. So this is one of the tools, one of the types of cards that we can put into the wallet, but it's not the only one, and we'll see some other examples of this. But the H cert is very useful for particularly when it's a small amount of information, like a single vaccine or a single immunization event, and useful for when you want a QR code that could be, for example, printed and doesn't require a smartphone. So we address some of the equity issues um, while making use of the H cert. But really, we are thinking of the wallet as existing in a larger digital public infrastructure um, with a foundational infrastructure, including digital identity services, financial services, a trust network, which are sort of cross-governmental services that should be provided on which a a digital public infrastructure for health can be built. And I know some of these things that will be tested, such as terminology services and the upcoming Connectathon. So we're really trying to make sure all of these things are linked together so that on the right-hand side, when you have an individual putting health content on their wallet, we know it's interoperable. We know it will work across multiple countries. We know the standards are there. We have assurance of that these cards will be useful. We don't want to get a situation, and we saw this a lot during COVID, where one country will produce a QR code and say, okay, we now have a verifiable health certificate, but it's completely different from one country to the next. It's a mess. Nobody can verify it, and we've lost interoperability. So really ensuring that we have strong interoperable digital public infrastructure is a key and critical thing for enabling the digital health wallets. And it's great that we're starting to go through the connecting and compliance testing process in the region. So maybe a little bit more about the testing process that is coming up. For what we're doing with WHO, there's two tracks. One is the IPS and something called verifiable health links, which we'll come to in a minute. The second track is on the ICVP, the International Certificate of Vaccination and Prophylaxis. We'll go into a few more details in a minute, but just to highlight in the testing, will be the actors that we're testing are the trust network participants. So those of you that are participating in the trust network that are receivers of verifiable health certificates. So you're receiving a health certificate and you want to verify the signature from the public key infrastructure and validate the content in that. So those tests are what will be set up for both the IPS and the vaccine certificate during the Connectathon, and we're helping to support that infrastructure. The way that we're supporting this infrastructure is we're making use of something called the interoperability testbed, which we're adding a number of different types of services to for verification, universal verifier for the QR codes, regardless of the standard, HCERT or Archeo or Smart Health Cards. We have the validation of the ICVP and IPS. All of these are services on the ITB compliance service, which you can do testing and sandbox testing against. And this is integrated with Gazelle, which is the platform that you'll be using during the testing event. You don't have to worry so much about the ITB for the Connectathon, but just to note, in the future, particularly when you have vendors that want to show their compliance, they'll go through the compliance testing and through a WHO-hosted ITB instance, and we'll make all of those compliance statements available. So that way, as purchasers or if digital health tools, you can ask for a compliance statement or ask your vendor to go through the compliance of WHO standards and have some reasonable assurance that the tool that they're selling is the tool that you're getting. And I'm sure many of you have experienced some challenges in that regard. So just want to maybe go into one notion I mentioned before, which was the verifiable health links. That's a new standard that's being developed through IHE. It builds off something called the Smart Health Links, which you might be familiar with, but it really is going to formalize a lot of the processes that we're talking about here, about the exchange of keys, the retrieval of keys, and how you verify documents with them. This is ongoing work. We're planning for to put it out for public comment in October. They're bi-weekly meetings. Very welcome to come. We really want to also ensure that you have your input. So when it does come for draft for public comment, we'll make sure that it's distributed to you. This should work within your jurisdictions and your settings. So this is a way for us to help come to global consensus together. So your review and criticisms are very much appreciated in making sure that this is a strong profile or standard. One of the things that one of the reasons that we had to develop the verifiable health link standards as opposed to the smart health links are related to auditability requirements. So, for example, in the EU, there's a requirement that all health records need to be uh, access to health records needs to be logged. Individuals should know who accesses that health information and when, and provide that detailed information. So this is a legal requirement that's coming from the EU. You may have similar requirements in place in your countries or within the region. And in that case, the Smart Health Links just doesn't meet that requirement because you can't do that, the auditability. So that was one of the driving motivations um, for the development of the verifiable health link. And you can see that put together a comparison of a smart health link versus the verifiable health link in terms of a number of categories of how it's transmitted, what can be verified, what types of trust relationships are established. We'll share these slides to you all. You don't have to read it now, but you'll have this information for the future. It's also within the IHE profile. Just to show you the highlights of what's in there now, we have sharers and receivers of public key material that are sharing it with the trust anchor. So sharers and receivers in this case would be you all as countries generating public keys for validation of signatures. WHO in this case would be acting as a trust anchor. And so on the left-hand side, we have that key exchange workflow. And on the right-hand side, we have sort of the documentation, retrieval, and verification workflow that's between the sharer, the holder, the individual with the verifiable health link or in their wallet, as well, and then to the receiver. The smart health essentially what we've done with the verifiable health links is taken the smart health links use cases and specification and wrapped it in an H-cert. So we've sort of combined sort of the best of both worlds, some existing infrastructure with the H-cert, the use cases around the smart health links, and now are able to meet sort of that auditability requirement. Finally, I just want to highlight a few other uses of GDHCN. You're not the only ones. The first one, and I think is quite critical, is related to the international health regulations. They govern the Yellow Book or the ICVP, which has the yellow fever and polio vaccines. And this is an international treaty that all WHO member states have agreed to, and this governs how the Yellow Book can be used. So prior to this 2024 agreement, we could only use a paper version of the ICVP by law. The digital ones weren't allowed to exist. So this amendment has made the possibility for the digital version of the Yellow Book possible. So the actual implementation of that begins later this month, and that implementation includes reviewing and coming up with the technical specifications. And so the work that you're doing in Ruxel, in the Conectaton upcoming, is to take those draft specifications and validate that they can actually be used and in context and are meeting the needs. So you are a very important part of this process of the implementation of the ICVP. I really look forward to your participation and also working with you during the Connectathon and getting your feedback. So you can see here just some changes in the language in bold. So we now can have both the digital and non-digital formats. We no longer require a wet physical signature by the clinician in the ICVP, which was a sort of a key blocking point for going digital. And just to highlight a few things, that this is only for yellow fever and polio vaccines according to a pre-approved list. We do recognize that the same infrastructure, the same needs can be quite easily extended to non-polio and yellow fever vaccines. So we've set up the specifications to ensure that that happens. It's just the regulatory framework, the policy only applies to the yellow fever and polio case. But the infrastructure, of course, on with a broader or different policy framework can be used for other things. So you can see we've started to take the ICVP and model it in a fire implementation guide. And those are some of the things that will be tested out in the upcoming Rexel testathon, Connectathon. We also ensure that there's a mapping between the International Patient Summary and the Digital Yellow Book or ICVP. So if you can do the IPS and it has vaccines in there, you should be able to get a digital ICVP. Or if you have a vaccine card or ICVP, it's digitized, you should be able to use that to populate an IPS. So there should be interoperability between the two. This is being used in the is planning to be used in the upcoming European vaccine card. They'll also use the Global Digital Certification Network. So we're really trying to make sure we have a common global digital public infrastructure. So if you travel to Europe with the vaccine card produced in your country, that it could also be recognized in Europe, as long as the needed data fields are there and they're interoperable. So it's um, uh, I think it's an exciting time in terms of um, uh, being able to take your health records wherever you travel. This is, I think, a nexus point of where we are globally, and happy to that we're all participating in this together. The last one I just want to highlight is the Hajj, which was mentioned at the very beginning. So this is when Muslim pilgrims go to the Kingdom of Saudi Arabia once a year. There's I think 2.5 to 3 million people that go on Hajj over a 2 week period. We have many people that are coming that are elderly, that don't know which medications are on. They don't really maybe remember exactly what their conditions are. They don't speak English or Arabic, and when they need to receive care, it's very difficult for them to communicate what their health conditions are. So Saudi Arabia wanted to make use of the International Patient Summary, augmented with some consent directives for pilgrims coming into Hajj. And so we've now done this 2 years in a row. It's used the verifiable health link specification or a pre-release of that, and the Global Digital Health Certification Network. And I think this could be a model that can be taken up uh, by you as well, as you consider, and this will be part of the testing in the Connectathon. You'll see the view of this. Um, so um, here, maybe just in the interest of time, I'll skip ahead, but just sort of shows the pilgrim's journey as they in their home country. They go through a health check, get granted a IPS access link, which on the right-hand side, when they go to visit Saudi Arabia, they can share that QR code and that access link to the IPS in at the hospital that they're in, which then retrieves the IPS from their origin country. And so all of the security and the verification built on the WHO GDHCN that was sort of pre-configured and pre-vetted in advance. Um, uh, Individuals there use national portals. You can to access their IPS in Malaysia and Oman. And in Indonesia, where they didn't have a national portal, they also had less of the population has access to smartphones. They printed the QR code on the back of their Hajj card, so they were able to ensure the equity of individuals to receive care as they went to Saudi Arabia. So with that, I'll conclude and again, thank you for your time.
Thank you very much, Carl. ¿Preguntas?
Are there any questions?
In the chat, Carl, there's a question for you from Miguel.
Thanks, Miguel. My understanding is that the same keys are being used as last year for the testing, and we don't need to upload new keys, but I would leave it to the Roxel team to confirm that.
Sí, Miguel, te contesto
That is
en
absolutely
español.
right, Miguel. Let me answer in
Efectivamente,
Spanish.
para la
You're
Conectaton,
absolutely right. For the
el
Connectathon,
proceso que hemos estado realizando ha
the
sido el de
process that
privilegiar la
we have been
reutilización de las
carrying
llaves
out
del
is
año
to
pasado.
prioritize the same keys
Bueno,
that we
entiendo que
used last
su key
year.
está
And I
configurada
understand that
en
in
las
your
últimas
case, it
pruebas a
has been
realizar este año,
confirmed. In the
este mes, perdón,
tests that we'll carry out at
quería
the
que
end of
todo esté
this
bien
month,
con
we
las
need to
llaves. Eso
double
se
check
una
that
de las
everything is
maneras de
okay
adquirir los
with the keys
certificados de
when we
vacunación
create
que
the
es parte de los
VHLs
ítems
and the vaccinations
que hemos
certificates, which
mencionado.
are part of the milestones
En
that
el
we have to
peor de los
comply with
casos, si
this
ustedes
month.
habían perdido la
In the
llave,
worst of
hay
cases,
que
if you've
generar una
lost the
nueva
key, then you
necesariamente
need
y
to
efectuar el
create
proceso de
a new
onboarding,
one
que
and
está
do the whole
bastante más
onboarding
documentado
process over
y
again.
simplificado, digamos, para este año.
But that it's a lot
Pero sí,
more
yo al menos
simplified
en mi
this
mapeo
year.
tenía solo un par
But
de
in
países
my
que tuvieron que
mapping, I only
regenerar la
have a
llave, ya sea
couple of
porque
countries
las
that had to
perdieron
recreate the
del
keys
año
either
pasado
because they
o
lost them from
porque
the server
finalmente
last
están
year
participando
or are countries
en este
that
tipo de
are
llaves.
participating this year
Y
for the
sí,
very first time.
la llave se mantiene la del año
But
anterior, es
yes,
decir,
it's
es
the
aún
same
con
key as the
certificado
one from the
y
previous year. If you still
la pueden reutilizar el año
have it, you
siguiente.
can then reuse it.
¿Alguna otra pregunta?
Any additional questions?
A ver, es interesante el tema de ir a
Yeah,
dispositivos redundantes
interesting. When going into
repetido
production,
en
that's an interesting
muchas
topic.
instancias.
We have repeated this over and over again.
Todo lo que tiene que ver con Conectaton estamos utilizando
Everything we are doing with the
metodología
Connectathon, we're using the
DHCA.
development environment.
Claro, en el fondo el proceso de
And
onboarding es
the
acompañado con
onboarding
monitores
process,
Raxel
sure,
para
we're
cada
having the Rexel
productos
monitors, but if you go into
se
into
debe hacer
production,
una serie de pasos que también son
a
formales
whole set of
para
formal steps
centralizarlos
need
vía
to be
OPS.
taken, and the idea
Ahora,
is to
dentro
centralize those
de
through
todo ese proceso
PAHO.
más formal
As
también hay
part of that
instancias
formal
de pruebas
process,
y
there
hay
are
dos
also some
ambientes de
test
testeo en
instances, and
dispositivos
there are
análogo.
two environments, one
Es
for
importante
testing
no
before
perder las
jumping into
llaves,
production.
aunque
It is
sean
important not
de
to lose the
desarrollo,
keys, even if it's
porque sirven también
development,
para los siguientes pasos
because
de
that will be
monitoreado,
useful
testeo,
for the next steps. So once we
considerar la
go
llave
into
que va a
that
ser nuestra
testing,
llave
and then
redundante
we need to
y
create
tenemos
that
solamente
final
esta
key
llave
that will be used, which will probably be different to those from the
pero sí
test
importante
or
verificar
development
rápidamente
environments.
y
So
aprovecho
yes,
de
very
nuevamente mencionar
important.
que el
And
proceso para el
once
cambio de
again,
dispositivo
if you want to
debe
go
seguir
into
algunos
production,
procedimientos
the process must follow some formal
y
steps
que
too. It's
esperamos estar
important to keep
avanzando
that
hacia
in
el uso
mind.
productivo
And
ya
we hope to
desde
be
post
moving forward
Conectaton.
towards
Próximamente
production
se lanza
after
el
the
código para
Connectathon.
forzar
That is
ese
one of the
paso
things that we want
pensando
to
en, sobre
reinforce,
todo, quienes tienen el
especially
compromiso de llevar el
thinking
certificado de
about
forma
the
prioritaria
commitment when
adelante.
we think about a yellow
¿Alguna otra
fever.
duda con este tema?
Any
Podemos
additional
pasar
doubts? If not,
a
we
la
can
siguiente
go
sesión, al siguiente
straight
escenario.
away
Si
to
quedan
the next
preguntas o si
speaker.
están
If there are any
tratando de
additional
elaborar, las
questions
podemos
that
al
come up,
final de la sesión
we
también
can
realizar
try
con
to see
nosotros.
whether we can address them at the end of the
¿Está bien?
session. Dan.
Thank you very much again, Carl. Probably if we have more questions, we could do it at the end of the sessions. Dan, vamos contigo.
Hola a todos.
Okay, hello
Primero quiero
everybody.
pedirles unas disculpas por
First
los
of all, I
slides.
want
La
to
presentación está en inglés,
apologize.
pero voy a
My
hacer la resumen
presentation is in English, but I will deliver the presentation in Spanish.
Voy a
My
compartir mi
fault,
pantalla.
my bad. Allow me then to share my screen.
Ahí pueden ver mi pantalla, ¿verdad?
Perfecto, Dan.
You can see that, right?
Perfecto. Bueno,
Yes, we can. Great.
la verdad que primero me presento, mi nombre es Daniel Abadí,
Okay, my
soy
name is Daniel
head
Abadi, and
de
I'm the
tecnología y
head
partnership de
of
CDPI.
technology
Estoy basado en
at
Argentina.
DPI. I'm based in
Tengo
Argentina.
un pasado con el sector
CDPI.
público, fui 4 años
I have been in the
la
public
cabeza
center.
digital de la República
I've
Argentina,
been the
donde
digital head
junto
in
con
the
el equipo que
Republic of
estaba en el Ministerio de
Argentina,
Salud en su
together with the
momento,
teams
armamos
that
la
was
red de
in the Ministry of
interoperabilidad
Health, and we
para
put
poder
together the
implementar la
interoperability
2019, que
network
incluyó el mercado de
between
vacunas
2015 and
en
2019, and that
2016.
included the
Em,
vaccination certificates in
y,
2016.
y la verdad que
And
venimos trabajando en
we have
CDPI,
been working
es
at
una organización pro bono
CDPI for some time. It's a pro
dedicada,
bono
somos agnósticos en cuanto a
organization.
tecnología, trabajamos con
We
gobiernos,
are technology
somos
agnostic.
apoyados
We
por
work with
donantes. Nuestros
governments.
dos principales donantes
We
son
have two
Co-Developed Bill
important
Gates
donors,
Foundation
co-developed and
y
the Bill Gates
trabajamos
Foundation.
alrededor del
And
mundo, en América
We work around the world, in Africa, Asia, and we try to give some of the support along the lines of what Carl mentioned. We work with the ecosystem, including the WHO, with in many of the projects that Carl mentioned. And Carl also talked about the digital public infrastructure. My idea is to briefly tell you what these DPI actually are and what we are thinking when we think about a framework for the region when it has to do with digital wallets, and then to share with you a brief example of the Argentinian digital wallet. The digital public infrastructure, if we think about it in the physical world, would be like the highways. Is those rails, those lanes where there is not one for the public or the private sector. It's the same infrastructure used for both sectors. And that's exactly what it is. Trying to find certain blocks that allow us to have innovation and to reuse it. We talk about digital identity. We talk about ways, different ways of means of payment. And all of these is based on five principles. The first one is interoperability, which is a minimalistic, reusable building blocks that has to do with designing ecosystems so that they are inclusive. That is to say, having a totally decentralized design. In 2000, we used to centralize, and now it's all decentralized, and especially designing the use with privacy in mind, security and privacy in mind. And obviously, when we talk about these blocks, I always give the different Legos, how we can build things with different blocks as an example. So we have blocks like identity, payments, also the exchange of data and the credentials too. We can share data in real time using FHIR protocols, for example, or also more synchronous, which is a verifiable document with a phone or even printed on a QR code. It has to do with these trust infrastructures, PKIs, digital structures that are created to have the necessary interoperability. So with these foundational blocks, plus some others, because we always add some new things here and there, new ingredients into the larger recipe, we can build different solutions that can be used. Digital identity in a country so that one country can allow in the public sector to open up, for example, an account over their phone because there's a rail or a building block which allows for the appropriate verification. Now, when we think about how digital public infrastructure can help the health sector, then we have to see how we're going to comply with these objectives, making sure that it's accessible, that there is a continuity, so that we can also reduce cost, make it affordable, and so that it can be audited. And the different blocks that we saw at the beginning can also be used for other approaches. And this is just an example for us to anchor this. This is in the health care. So it's a patient, whether it is in different institutions or for medication. We can talk about payments for the funding of the health sector, whether it's a public or private sector, and some of the coverage that you may have. We can have then all of our information and we can take it from one place to the other because in the end it belongs to us, it's ours. Obviously, we can talk about, well, health records, we can talk about the whole infrastructure and the different blocks then can be seen, can be moved around, and we can use them in different ways. When we talk about sharing data, exchanging data. We can talk about real-time exchange at a very granular level, a verifiable credential, and open data sets that are anonymous that add value for research and monitoring purposes. So there are different stages with different conditions, and all of this is connected to the stack of smaller blocks that build a larger ecosystem. For the health sector, we have registries, we have identities and payments, credentials, consent, digital files, open APIs, exchange, vouchers and payments. There are millions of blocks. And and this is just the introduction, but the idea is just to give you a general overview. The power behind this, when we can have a block, or we can make it a very specific, it can be reused for many things, and that means that we don't have to continue reinventing the wheel over and over again. So when we think about the work on the Conectathon, what should a framework be like for digital wallets in the region, in the healthcare sector? Looking at some of the experiences that are out there, we as Latin American and the Caribbean have to follow our own path and to move forward in these discussions that we're having in order to actually think about the model that we're going to be using. And I just want to leave you a couple of ideas of some of the things that we're doing. And obviously, the next step is to start discussing this as a larger community. So, first of all, a framework has got to be anchored on three pillars. And I will not repeat what Carl has already said regarding the auditability. The W3C, unverifiable credentials, is one of the pillars that we could use. We also see the fire nodes with HL7 that you're already working with. That's another one of these pillars. And obviously, everything else that Carl mentioned with the Global Digital Health Certification Network, that trust network with signatures that allows to verify whether the signature is the right one, and also the model that he showed for the health digital wallet. So these are the three pillars that we can use to start discussing. Say the world is heading in this direction, and maybe Latin America should go in that direction. I do not see if anyone is writing questions in the chat box, by the way. You can tell me that. Also, we have to think about design principles for this reference framework. I don't think that the frameworks are necessarily mandatory for everyone. I think that each country has got to have their autonomy and the freedom to build whatever they want. But I do think it's important to agree on having some design, some reference frameworks that are important for us to agree upon so that we can have some design principles that we all have in common, person-centered, so that they have control over the data, so that we need to have a regional and global interoperability design principle, so that regional interoperability, it could be either within the country or with the neighboring countries, but also Europe is, for example, paving its own road. And then how can we create that connection without necessarily having to adopt the European framework for a non-European area? The same thing with Africa, for example. So how can we make that a validation? These are things that we all need to discuss.
una implementación más
I also think that it's got to be an
incremental y más uno, que tiene que
incremental
ver con que a
deployment, and I've
veces
written here
pensamos
plus one
que
approach,
todo le tenemos que
because
rediseñar
we
y la
think that
realidad es
we
que no
all need
tenemos
to
el
redesign
dinero ni
everything.
nunca
But
vamos a
truth
tener
be
el dinero
told,
para
is
abandonar
we're
nuestras
never going to have
gestiones. Entonces, ¿cómo
the money to
upgradeamos
do
lo que
so.
ya
So
estamos,
how can we
lo que
upgrade
tenemos?
what already exists?
Tiene que estar 100% con un principio de
It's
diseño de la
got
inclusión
to
y la inclusión
have
digital, que
a
esto siempre
design
tiene que
principle
llegar
of digital
hasta la
inclusion.
última milla.
This has
Mencionaba
got to
el
work
teléfono
until the
inteligente
last
mortal
mile on
y tiene
the
que funcionar
most
en el
expensive
papel impreso
smartphone,
con un
but
QR
it's also
de la misma
go to
manera,
work on a
porque eso es lo que
printed piece
garantiza
of
la
paper with a
adopción.
QR code, because that's what
Porque lo que hoy estamos
guarantees the
intentando
real inclusion.
batir o
What we're
ganarle es el
trying
papel.
to
Digo,
beat
hoy todo
today
lo que
is
es el
anything that's
papel o
paper-based. The
una
paper,
memoria USB, llevarlo de un estudio a un lado al
you
otro,
can
cuando
overcome
podemos
that
hacerlo con
with
una
a
segunda
USB
consulta
memory
porque tenemos un
stick.
problema de salud.
But if
La
we can
mayor
do
parte
that,
de la
but
gente,
most of the
digo,
people
no somos los que queremos
are
viajar al Club Med en
we
2
we
horas y
don't want to
necesitamos la
go
primera
to the
milla. La mayor parte que toma su
most of the
registro de salud y
people
usa
that
tu mano
use
para una
their
consulta es
health
porque tiene
digital
poder
health
médico.
records,
Entonces, las
or
personas
that have health
extremadamente
records are
vulnerables.
people that are extremely
Y después
vulnerable.
tenemos que obviamente llegar
Therefore,
a
we
la
need to make
seguridad
sure that they are
y este diseño
included
que tiene que ver
too.
con
And
privacidad.
we also need to have a design
¿Cómo
principle
podemos
that is
ir
based
a
on the
la
privacy by
atomización del
design.
dato
How can
para
we go
compartirlo?
to the data scattering,
Y creo que con esos principios de diseño
but
podemos después
privacy
empezar a
by
crear
design? So with
estándares
these
y cosas que nos
design
permitan, pero
principles,
esto es
we
como
can start
si tienen
developing
ciertas
some
reglas
standards.
de
So
universo.
it's like having
Cuando hablamos de
certain
credenciales
rules to
verificables,
follow. When we talk about verifiable credentials,
simplificamos, y esto ustedes lo vienen viendo en 3
we
puntos.
we
El
can talk
issuer
about
es el
these,
que
and I know
emite.
that it's
Cuando
simplified.
hablan múltiples
The
emisores, digo, los
issuance,
ministerios de salud pueden ser un
the
emisor,
ministries of
así como
health,
también las
for
agencias, así como
example,
también
but
otros
also
organismos del Estado
agencies and
pueden
other
emitir. Y hay
state-owned
múltiples emisores, hay
organizations.
múltiples
So there are
billeteras,
multiple
puede haber la
issuers.
billetera
There are
de la Organización
multiple
Mundial de la Salud, que
wallets,
puede haber una
one
billetera de
for
su
the
país y puede haber una billetera de
WHO, for
todos sus
example, there could be one from
gobiernos
your
subnacionales,
country,
puede ser de una
or for
provincia,
the
un estado, una
subnational
ciudad,
governments. Why not a certain
y esos son
city, a
los
certain
holders, quienes
province?
tienen la
Those
billetera. Y
are
después
the
son
holders.
las
And
organizaciones que
then
emiten.
we have the
Y en esos 3
verifiers.
tienen
And in
módulos,
these
conviven en
three
relación de
modules, we have
el
then this
intercambio asincrónico de datos se
exchange,
permite en
the
estos casos, ¿no? Digo, alguien me emite una credencial y yo
asynchronous exchange of
tengo mi
information.
dispositivo y nunca la uso
A
hasta que no la
credential
voy a usar.
is issued and I have it in my
Ponele,
device and I never use it until I need to.
entonces, estas son las definiciones que empezamos a
So
tener
these are
sobre
the definitions that we
cómo se
need to
construye
start
bien lo que es
having
un
on
virtual
how
map, qué
what is
están las
built,
cosas.
what
Creo que
isn't,
este también es un camino
what's
que vamos a
used,
empezar a
and what's
recorrer.
not. So this is another
Muchísimo por
uh,
hablar en la discusión que
journey
tenemos
that
en el
we need to
grupo y es el
take.
grupo para discutirlo,
This
tener
is
la
the
verificación
group
nuestra
in
es la
order to
cross-border
discuss this.
para los países externos.
When
Digo,
we talk about
¿cómo hacemos que el
cross-border
país A,
verification, how can we make
las
sure
personas
that
del
country
país A puedan
A
verificar su
and that the
información en el país
people
B
in
y así?
country A can
Entonces,
verify
tiene
the
que haber
information
mucha
coming
discusión
from
sobre eso,
country
mucha
B?
discusión
There's
sobre el
got to be
checkout
a
de
lot of discussion
los
on
trust
this, and
domains y
Carl
mientras más
mentioned
alineado a lo
a
que ya
trust
viene en el
domains.
grupo de
We need to be
mejor.
absolutely sure that this
Y,
is all well
y en
aligned.
esto
Carl mentioned
quiero
a lot of
contarles,
this, so I'm going to
si
go
me sirve
straight
el
into the
tiempo,
next slide.
de mi experiencia
And I
y
want
de
to
los
tell you
puntos.
about our
Cuando fuimos a
experience.
Argentina, lo
When
primero que agregamos
the
fue la
first thing that we did in
credencial
Argentina was
digital
a
de la donación de órganos.
digital credential for organ
Hicimos la
donation.
donación de órganos
We did
extremadamente
that,
fácil en la web, si bien después hubo una ley que reemplazó
and
donaciones
although there
anónimas,
is a law,
antes eso no existía y la
the
realidad es
law
que
did not
la
exist in
mayor
the
cantidad de
past,
personas que
and so
expresaban voluntad
most
de
of
donar
the
los
people that
órganos era el
expressed
día
their
mundial de
decision
donación de órganos,
to
que obviamente
to
era el día que el
to,
website
to
se caiga
donate
y la única manera era hacerlo
uh,
antes, lo cual
organs
eso
was
nos llevó
on
a la
International
decisión, bueno,
Donation
veamos una
Date, and
credencial.
then we said
Después,
that's not good enough.
obviamente,
So
el
let's
Ministerio de
try
Salud de
and
Argentina
have
tenía algo que
one of
se
these
llama
credentials. And then the Ministry
una
of
base de
Health of
datos centralizada
Argentina
donde
had a
todos
database where
técnicamente las
they
instituciones públicas y privadas de
technically,
salud deberían
public
notificar a todos
institutions,
y ser
should
registradas a cada
notify
paciente
who the
y eso nos
donors
permitía
are. And that allowed us to retrieve that information and retrieve those certificates and to put that as part of the health certificate that allowed us to have later other types of certificates. But this view of trying to make it easy and trying to make it verifiable is directly linked to the user. We have vaccination certificate first. That's what we did first because we felt that it was going to be interesting. I'm talking back in 2016, but it was also a requirement in order to access to certain social welfare benefits. You needed to have certain vaccinations, for example. So I just want to close with this. And when we look ahead and moving forward, there are still other topics that we need to discuss. For example, the governance and how to institutionalize this in our different countries. How do we institutionalize the cross-border data exchange? What's the regulatory framework that creates a sustainable development of this work beyond the people that are participating right now? We have to use then verifiable health credentials and cross-border data sharing. We need to agree on the verifiable credential standards and interoperability for the region and the framework. We need to discuss with a focus on the use cases, but not technology. We get excited when we talk about technology, but we have to think about the use case. That is to say, how do we solve certain situations, certain services, or certain access for the users, and how can we make sure that they receive the benefits, especially people that are in extremely vulnerable situations, especially if it's health related. And that's why when discussing with Raxel, we also need to think about to carry out an assessment on the DPI maturity of each of the different countries. Trying to say, this is the snapshot today, and then to take a different snapshots so that we can see the progress that we're making. So with this, I think that's all. So I want to thank you for your time.
Muchas gracias, Dan, por tu presentación.
Thank you, Dan, for that presentation. And we do have some time for questions or doubts, if anybody has any. Any comments? Fernando? Go ahead, Fernando.
Sí, muchas gracias, Dani, y bueno, y a Carl también.
Thank you, Dan. Thank you, Carl.
Carl está por ahí todavía, sí.
Carl, are you there? Can you turn on your camera?
Yeah, I am.
Yes, thank you. Probably only which could be for both, no? Because as we see, definitely this approach that to use the certifieds created are validated by the GDSCN, as we are seeing that is the country authority. We have this type of certifieds, and probably at the end, some of it could apply for the vaccination certificates because they are issued by the health minister. However, probably we will have other type of documents, for example, IPS summary or medication requests, etc., that could be assigned, issued by the health institutions. So how could be we could combine these two type of, we could say, national certifieds and local certifieds, which could be the roadmap around to adopt these two type of certifieds. As GDSCN, until we understand, is for health authorities, but probably other type of documents could be signed by health organization directly by the hospital, something like this, which could be your view in this direction. If both could share with us something. Thank you.
Yep. No, there are a couple of different options, and I think it really depends on each countries, sort of what makes sense. So maybe just from the WHO perspective, we deal with the Ministry of Health, the health authority. So if a health authority recognizes a health institution, and then shares that recognized health institution to WHO, then we could add them into the record. So as long as the various health institutions are authorized and the Ministry of Health agrees to that, then from the policy perspective and from what goes into the keys that could be shared, that's fine. From a sort of technical perspective or solutions perspective, you could either say, well, each of the institutions or maybe each of the vendors has their own public-private key pair and they share their public key with the Ministry of Health. Or the Ministry of Health could say, oh, we're going to be responsible for all public-private key pairs. They generate the public-private key pair and share that private key with the institution to use for document signing. Or third option is to say that the ministry will set up a document signing service. So the institution sends an unsigned document to the Ministry of Health to do a document signature, and then they distribute that to the individual. So depending on the type of infrastructure, and you've got those options. From the policy side, we would support all three. Hope that answers.
Thank you.
Sí, yo sí puedo agregar coincido con Carl.
Yes,
con la
I
acción.
agree
Creo
with
que
Carl,
la mayor parte de los
but
emisores
most of the
de
issuers
credenciales y
of
documentación es el sector
credentials
privado
and
y son los
documentation is
médicos,
the private
los
sector,
profesionales de salud.
and it's
Pero,
the
en
practitioners.
países como, vuelvo a Argentina, por ejemplo,
Let me go back to
pero
Argentina
creo
simply
que
because I'm more related to it,
la
but
prescripción electrónica de
the
medicación, creo que
electronic
100%
medical
digital,
prescriptions, for
es un acto
example,
privado
it's a
homologado por
private
el regulador, que es el
practice,
Ministerio de
but
Salud de
is
la Nación, en este
authorized
caso
by
los
the
superintendentes propios del
ministry,
Ministerio de
and
Salud.
there's also a
Y creo
superintendency
que
involved. But
eso
that
crea un puente, digo, después tiene que ver
create that
como,
helps us to
como decía
create a
Carlos,
bridge,
si
and
se
then it
ajustan a
has to
los
do with
estándares es
like
fácil,
Carl
pero
says,
el día
it's got to meet the
tenga
standards for
ahí
interoperability
la sea. Creo
purposes,
que
but
ese
once
es
that
el
has
modelo
been
también
solved, then the
de
country has got to regulate it as they
WHO,
please, really.
donde vos
And that's the
vas a hacer
WHO
compliance con lo que
model
te
that is
piden
used, so
y
that
ninguna
as long as you
termina de
comply with
definir
what the
en tu
WHO
casa
is
las reglas que
requesting,
quieren, ¿no?
then inside your country, in your house, you can have your own rules as they apply.
Okay, gracias.
Okay, thank you.
Thank you, Carl. Gracias, Dan. Gracias, Fernando.
Thank you,
Dos
Carl,
minutos
Dan,
quedan
and
espacio
Fernando.
para
We have
una última
2
pregunta, si
minutes,
alguien
maybe
la tiene.
one
Si
additional
no,
question if
podemos
anybody has
dar
any.
por cerrada la
And if
sesión
not,
de hoy.
then we can close this session.
¿Duda o un comentario
Doubts,
de esto,
comments
de hacia dónde vamos? Mientras
on
yo les puedo
this,
ir
on where we're
comentando
heading? In the meantime, I can tell
información
you,
general de
or I
los
can give you some
webinars.
general
Este
information
webinar
on the
es
webinars.
parte
This webinar
de un
is
conjunto
part of a
de
set
webinars asociados a la
of
temática de wallet.
webinars
Recuerden que
related
tuvimos
to
el
digital
primero
wallets.
de self, que
Remember
es un
that
poco
we
más
had
técnico,
the
y
last,
este que
the
nos
first
faltaba,
one,
que tiene
which
que ver
was
con
a little
la
more
visión de las
technical.
wallets asociadas
This one, which
digital,
has to do
los
with the
frameworks,
digital
y que
wallets and the
un
frameworks,
poco se contextualizan dentro
which
del
is
trabajo que
part
también
of
queremos realizar
the
desde la región en
work
la
that we want to
difusión
carry out
de cómo aprovechar las wallets para
in
hacer
this region
digital
on how to
nuestro mundo,
take
introduciendo este
advantage of the
tema
digital wallets.
en la región, ¿cierto?
We're only
Nos
just
queda un
introducing
tercer
this topic
webinar
in the
que
region,
tiene
but we still
relación a
have one
una
third
herramienta para
webinar
una prueba de
that is
concepto
related
en
to
wallets que
a
va a estar
proof of
disponible para la
concept
Conectaton. Eso debe suceder en 2
that
semanas
we're
más.
going to carry
Y
out
con
in the
eso
Conectaton.
cerramos
That
este
will be
ciclo
available in 2 more weeks.
asociado a lo que es
And
la
with that,
wallet.
we
En
will
ese
close
webinar
this
vamos a presentar una
cycle related
herramienta
to
para que los
wallets. In that
países
next
integrantes
webinar,
que
we're
hablan
going to
Conectaton la
share
puedan
with you
descargar
a tool if
y
you
hacer
want
una
to use that in the
interacción
Conectaton. You can
entre
download it
los
and you can try and have
DHL
an
y los
interaction
certificados de
between
vacunación y CBP que
VHL
estamos preparando
and
para
the
la Conectaton entre
ICVPs that we
la
are
app que está
preparing for the
desplegada y
Connectación,
la
between
wallet que va a
the app
estar
that has already been
disponible.
deployed
La idea de
and
ese
the wallet
webinar es
that
que
will
sea un
be
paso a
available.
paso
and we will do that. We will show you a step-by-step webinar on how to use those tools. That's in 2 more weeks, as I said. But today, in the afternoon, we have another webinar. This is now for IHE and the Gazelle registration. We're going into the last pre-Connectathon stretch. Remember that the virtual Connectathon has been scheduled for the first week of October. The challenge for the countries is to start preparing the test patients, to start preparing the IPS, the vaccination certificate. This is in 1 or 2 more weeks, so that when we come together in El Salvador, we can do the peer test, exchanging the health records for both tracks, and to use all the time in carrying out the largest amount of tests possible. So we are in the home stretch. You each know the status that you are in, and I would like to ask you to please catch up. We have to have the health certificates as well as the IPS ready so that we can have a successful Connectathon. Today, we will have the Gazelle registration webinar. Gazelle is the tool that we use for the Connectathon test, and registry is a requirement to be able to participate. For those of you who do not recall, let me tell you then that you simply have to fill out some forms. Who will be the participants on the technical side? Who will be carrying out the test? Who will have the permits and uploading all the necessary information? And also some things regarding the platform. You need to set up the country platform and you need to connect that to Gazelle. All of that is part of what we're going to be seeing in the registry webinar today, 3 o'clock in the afternoon, Santiago time. So I'll see you this afternoon once again. There are no additional questions apparently, so I think that we can adjourn this meeting. Again, please catch up and see you in the afternoon. Those do not forget that participating in the registration webinar is mandatory. Thank you so much, Carl, and thank you so much, Dan, and also to all the participants. This video will be available in our communication channels. See you later. Bye-bye.